The pandemic also changed the way students learned about medicine, from remote learning to changes in clinical studies. It hasn't been an easy year. Now, as our Lindsay Amundsen reports, students at the University of Idaho's medical school are getting hands-on experience in administering COVID-19 vaccinations.
Interestingly enough, medical schools really shut down for the first time in the history that I've known. That we stopped clinical training and things like that, really to preserve PPE and not overburden the hospital system.
He says people go to medical school to help others, and not being able to do that.
It's been really frustrating in the sense that it's something I want to help with, and I think all of us want to be able to make a difference and be useful, but we're just like one step short of being able to really do something about it.
How do you train a physician if they can't be in the setting and be doing things? And so we were all worried nationwide, what's the product going to be at the end when they graduate if we can't do some of these things?
So faculty came together to find a way to get the students more experience and out helping on the front lines. The medical students were properly trained and are now giving the COVID-19 vaccine to patients in clinics.
So this one came out nice. There are no there are bubbles.
It's like, a really exciting time to see the students fulfilling their dreams.
As a first-year med student, everything's exciting. And so learning how to give vaccines and being competent in that skill is really important and a really fun thing.
And even though this year wasn't what they planned, he says it's made them more resilient. With medicine constantly changing, physicians have to be able to adapt quickly.
This pandemic really created, an opportunity for our students to really see that, okay, this isn't exactly how I planned. And guess what? When I graduate, it's not going to be exactly how I planned. There's going to be something else. And they need to be prepared to think on their feet, to critically analyze things, to adapt and adjust, and to the realities that are in our healthcare system.
A silver lining to going to medical school during a pandemic.
I just want to be 2 fingers below that.
There are opportunities for us to see how it has strengthened us and how it has made, I think it's going to make a greater and a better and a more knowledgeable and resilient physician in the end, because they went through this experience in their training.
Lindsay Amundsen, Idaho News 6.